Hi guys, I hope you are doing good. So we are starting our new episode of Krok 1 explanation of general medicine, and we are starting with the year 2008, and in this video we will be explaining the first 25 questions. So let's start. In this question they are saying that the patient has a condition called steatorthea because he consumed rich food in lipids that caused him nausea and heartburn. And steatorthea is the presence of undigested lipids in the stool. So this is because of bile acid deficiency. Why? Because functions of bile are digestion and absorption of lipids and cholesterol excretion. As you can see here, the gallbladder where the bile acid is formed, then the gallbladder exits the duct to go to the duodenum, where from the duodenum goes to the intestines to digest our lipids. So if we have a problem with bile acid deficiency, then our lipids will not be digested in our intestines. Next, this patient is having diarrhea from improper feeding that its main effect is plentiful excretion of sodium bicarbonate. Let's see here our beautiful body. If we divide it into two halves, as you can see here, the stomach, this is the most acidic place in our body, where the hydrochloric acid is mainly secreted by the parietal cells of our stomach. So if we have excretion of the stomach content, which is vomiting, then we're having metabolic alkalosis, because we have like excess acidic matter that exits the body. So as a result, we're having alkalosis. But in the intestines, we're having sodium bicarbonate. So you can imagine what will happen if alkaline matter exits our body, means we're having acidosis. So that's why it's metabolic acidosis, because it's diarrhea and not vomiting. Next. So in this question, the child was given aspirin, which resulted in intensified erythrocyte hemolysis, and this hemolytic anemia is caused by congenital insufficiency in glucose 6-phosphatase dehydrogenase. Because as you can see here in this scheme, glucose 6-p dehydrogenase, or 6-phosphate dehydrogenase, is the main enzyme that reduces the NADP plus to NADPH, and hence we need it as, like, in another consequence, to produce glutathione peroxidase that reduces the NADPH and detoxifies the free radicals. So as you can see here, decreased NADPH in RBCs leads to hemolytic anemia. So as like the beginning of the this chain, we find this enzyme as the main reducer of NADP plus to NADPH, as we can say, producer of NADPH. Next question. The patient is ill with diabetes mellitus and was accompanied by hyperglycemia. So we estimated over the last 8 weeks before the examination, we can estimate his blood glucose through glycated hemoglobin, because as you can see, the life of one single RBC is 120 days, and glucose actually, even like if you're fasting, or you just want to do like morning analysis of blood, your blood glucose can be really low. But if the doctor wants to estimate your blood level, your glucose blood level in the past even month, he can like take your blood and analyze the RBCs and find within the RBCs attached the within hemoglobin the glucose molecules. So glycated hemoglobins are a marker of previous glucose levels within the blood. Next question. So in course of a laparotomy, a surgeon revealed gangrenous lesion of the descending colon, which is caused by thrombosis of the following artery. It's the left colic artery, and as you can see here in the scheme, you can see here the left colic artery and here the descending colon. So the left colic artery supplies the descending colon. Would we have gangrene or any type of vessel problem or thrombosis or like gangrene, if the middle colic artery is the one who is thrombosed, then we're having a gangrenous lesion in the transverse colon. If we're having a thrombosis in the right colic artery, means we're having a problem in the ascending colon. And you can see here the scheme. If we're having a problem in the rectal artery, means we're having a gangrenous lesion in the rectum. Next question. In this question, the patient is suffering from obliterating vascular endarteritis of lower limbs. He was taking phenylene, as you can see. But he was having some convulsive disorders, and he was prescribed phenobarbital. So withholding this drug means withholding this phenylene caused nasal hemorrhage. So they're telling us that he actually kept taking phenylene, but it was not working. It was not working, and this is connected with induction of enzymes of microsomal oxidation of liver caused by phenobarbital. As you can see here, phenylene is antithrombotic agent, and phenobarbital is the main factor that caused the withhold of this drug. Why? Because as you can see from, or as you can remember from biochemistry, the cytochrome P450 here is an enzyme that induces the metabolism of some drugs. So cytochrome P450 mainly metabolizes phenylene, and phenobarbital is an inducer of this cytochrome P450. So you can imagine if we're having an inducer of an enzyme that works on the metabolism of a drug, you can think of that, like how will phenylene can work. It cannot actually, because it's not given time or anything. It's the cytochrome P450 metabolizes phenylene in a fast way and in large quantities, so that it doesn't even get the time to work on the vessels and to do the antithrombotic work. So next, the patient lost perception of high frequency sounds, and this is caused by the damage of the main cochlear membrane near the oval window. As you can see here, the external ear, the middle ear, and the inner ear. And the perception of the high frequency sounds is mainly near the oval window here, and as you can see here also. So here we have the main high frequency sounds that can be perceived. So if you find in the question like perception of low frequency sounds, you go and choose halicotrema, of course, as you can see here. Next question. Yeah, so For isoenzymes, you can remember from biochemistry that isoenzymes are enzymes that are catalyzing the same reaction. They can be different, like they can have different amino acid order, or even like they can be produced from different genes. But the main common thing between the isozymes is that they catalyze the same reaction. Here we can see an immature mRNA, and I can show you here an immature RNA, that contains more triplets than amino acids found in the synthesized proteins, and the reason is that translation is preceded by processing, and processing is a process where the introns are getting removed. As you can see here, only exons can produce some amino acids, because introns are useless parts that after translation they can be removed because of the processing. The next question. So here the question is about the place of protein biosynthesis, as they mentioned here, is ribosomes, but they're asking like what stage is protein biosynthesis impaired. Means like as you remember from biology, there are two main processes or stages from DNA to protein synthesis, which is transcription, that goes from DNA to RNA. This is transcription. But here we're talking about protein biosynthesis, means from RNA to transcript RNA to amino acids. So it's translation. As you can see here, translation is protein biosynthesis and transcription is from DNA to RNA. Yeah. Next question is that the student was taking notes, but his neighbors started talking, and this caused a conditional reflex inhibition. And this one is external, and it's very clear that the factor was external. That's how you can remember this. And also because this has nothing to do with the student himself, so it was an external reflex, or an external condition, sorry. The patient with neurodermatitis was taking prednisolone, and neurodermatitis can be an autoimmune disease. So prednisolone is taken to decrease the level of immunity and hence prevent the exacerbation of neurodermatitis. So he was taking prednisolone for a long time, and examination revealed high rates of sugar in his blood, and this is because of gluconeogenesis activation. So gluconeogenesis, for prednisolone, this is its main side effects, as you can see here: hyperglycemia, immune suppression, as the case that we used it for, and gluconeogenesis is the production of carbohydrates from lipids and proteins from a substance that is not a carbohydrate. It's in the liver. The next question. So we took labeled amino acids, alanine and tryptophan, were injected into a mouse in order to study the localization of protein synthesis. So we should know the localization of protein synthesis. So if we label these amino acids, we will find them accumulating in the ribosomes, because the ribosomes are the units where the proteins are getting formed in the translation process. The next question. The patient was having frequent attacks of stenocardia, and he was prescribed Sustat-Fort. But at first effect was positive, but on the second day, stenocardia attacks resumed, meaning they returned. So this can be explained by inefficiency of this type of inefficiency is called tachyphylaxis. So tachyphylaxis is a medical term describing an acute and sudden decrease in response to a drug after its administration, and it's mainly linked with time. But if we have by utilization and by use, the effect of drug will decrease. This is dependence. But if we have the main factor that caused the decrease of the efficiency of the drug is time, that means it's tachyphylaxis. So the inflammation of the tympanic cavity was complicated by inflammation of mammillary process sockets. And as you can see here in this scheme, this adytus, this is the posterior wall. Well, the answer was because the pus penetrated into the socket through the posterior wall. And you can see here through this adytus, the pus will penetrate the posterior wall and go to the mammillary process that is present here. In order to speed up healing of a wound of oral mucosa, a patient was prescribed a drug that is thermostable, occurs in tears, saliva, and mother's milk, as well as new-laid hen's eggs. So it is a natural resistant factor of an organism, and it's called the lysozyme. What I want you here to remember is lysozyme is a part of the innate immunity, and it's a great antimicrobial agent in the body, and it's very, very powerful. Actually, you can find it as a first-line defense against bacteria, against viruses, or in general against microbes. Next question. An aged man has risk of arterial pressure under stress. So this is caused by sympathoadrenal system. This is a physiology question. As you can see here, the sympathoadrenal system is mainly induced by the medulla part of the suprarenal glands that secrete the epinephrine and the norepinephrine, known as adrenaline and noradrenaline, and these two hormones lead to an increase in the arterial pressure. So they are mainly secreted under stress. So don't stress yourself, guys. So in this question, the patient is complaining of general weakness and quick fatigability. And this, after blood analysis, we found that hemoglobin is very low. As you can remember from physiology, normal levels of hemoglobin for males is from 132 to 173 gram per liter, and for women is from 170 to 155 gram per liter. So 80 is a low level. And erythrocytes are of modified form, as you can see here in sickle cell anemia. These cells look really like a sickle. So this is actually a problem, like a genetic problem caused by substitution of glutamic acid with valine. Means that the glutamic acid is replaced by the amino acid valine, and hence it causes the sickle cell anemia in these patients. The blood minute level of a 30-year-old woman at rest is 5 liters per meter. So what volume of blood is pumped through the pulmonary vessels per minute? 5 liters. It is very simple because actually the blood minute volume, you can meet it as cardiac output in other questions, or even when you were having physiology, you could see cardiac output. This is the blood minute level, minute level, and it's the average is 5 liters. But here, if you divide like 5 by a minute, it gives you 5 liters in 1 minute. So in this question, as a result of a long-term starvation, the glomerular filtration of a man was accelerated by 20%. And this is this caused the fall of oncotic pressure of blood plasma. So if you can see here the starvation, that means the patient was not taking enough food, and this food mainly was lacking proteins, and the main proteins that work on the oncotic pressure are albumins. So if you lack albumins in your diet, you must not only have glomerular filtration rate problems, but also very severe edemas in every part of your body. Here, we're having the patient has yellow skin color, dark urine, dark yellow feces, and this substance that's strengthened, like that is present in the blood serum in a big level, is unconjugated bilirubin, as you can see here. The unconjugated bilirubin in the hepatic jaundice, actually, you can see that color of urine is dark, and you can see also the color of stool can be normal. Well, they say here it's dark because the natural color of feces is actually dark. So it's actually hepatic jaundice that caused the accumulation of the unconjugated bilirubin in blood. The next question. The patient consulted the doctor about symmetric dermatitis of open skin areas. And this patient was mostly living on just cereals, but ate too little meat and milk and eggs. So the deficiency of the vitamin that is present in many is a form like in many food, especially in meat, milk, eggs, and you can actually find it in many vegetables, many fruits. It's also one of its names are niacinamide, and it's a form of vitamin B3 found in food and used as a dietary supplement. And also the deficiency of this vitamin can cause the 3D. So it's dermatitis, dementia, and diarrhea. Dementia is a loss of memory. It's a neurological problem, actually. The next question is the patient applied to the doctor complaining of pain in joints that becomes stronger the day before weather changes, and the blood examination revealed the high concentration of uric acid, and this is because of the intensified disintegration of the adenosine monophosphate. So you can see here in the scheme, the adenosine monophosphate is the precursor of uric acid formation. So if we have like disintegration of the adenosine monophosphate, we'll definitely have many increased value of uric acid within blood. The next question is that the patient suffers from rheumatism in its active phase. So the C-reactive protein here is the the marker of diagnosis, and it's present in the serum in the active phase of these diseases, because actually it's a marker of inflammation. So you can find C-reactive protein in scleroderma, in juvenile arthritis, systemic lupus erythematosus, relapsing polychondritis. So rheumatism and active phase, like you have to choose the inflammation marker actually. The last question in this video will be we had ECG of the patient, and with hyperfunction, the patient was diagnosed with hyperfunction of thyroid gland, and in the ECG we found depression of the RR interval. I can show you here the RR interval. So it's depression mean that either we're having like a short interval, like interval that gets shorter, that means hyperfunction of thyroid gland actually gives tachycardia. So yeah, a tachycardia can be manifested in the ECG as like a short interval between the RR points. So that's it. I hope you enjoyed with us, and we hope that we really explained some of the information that will help you to memorize more the questions. So good luck to you guys, and see you in the next 25 questions.